Good morning, everybody. My name is Dr. Faizan Aziz. I'm a consultant pulmonologist at Zoi Hospital, Amit. Today, on the occasion of World Tuberculosis Day, which is 24th March, I'm here to give you a brief insight on the disease tuberculosis. Tuberculosis is basically a disease that is caused by Mycobacterium tuberculosis, primarily involving the lung and also extrapulmonary involvement. TB can happen to anybody, anywhere. In a country like India, where TB is very rampant, we have many cases diagnosed of tuberculosis each year. According to the recent updates, every year we have more than 25 lakh cases of tuberculosis with more than 2 lakh deaths per year, which is huge. And even during the COVID pandemic, the number of deaths caused by tuberculosis were much more than the ones caused by COVID. But because we as Indians are used to tuberculosis, there was not a big fuss about it. TB, firstly, looking at the disease, who are the people who are at risk factors for tuberculosis? Firstly, diabetics, old age, people hypertensive, malnourished people, people with low socioeconomic backgrounds, emaciated, people malnourished, and people on steroids, immunosuppression, on long-term medications. These are people who are generally predisposed to tuberculosis. Now, looking at the disease pattern, the TB disease can involve the lung and also the extrapulmonary involvement, like lymph nodes, bone, any other part of the body can be involved with tuberculosis. Most of the people have a stigma that TB is something which is not to be disclosed because in India, especially in the low socioeconomic group, you have a certain section of society who consider them as an outcast, and that is the reason why most of the people diagnosed with tuberculosis have a certain inhibitions about revealing the disease. And that is the reason why the treatment of tuberculosis by these patients is not effective. Most of the patients diagnosed with tuberculosis, to begin off with, they need to take anti-tubercular medication for 6 months. But most often what we see is patients do not adhere to this treatment. There are no routine follow-ups. Most of the patients give up medications because being a prolonged disease with duration of treatment being 6 months. Most of them do not adhere to the treatment, have no routine follow-ups. Many patients might develop adverse effects like vomitings and discoloration in the urine, which can create a sort of a panic, and as a result of which they discontinue TB medications, which is very harmful. And in the long run, what happens when the patients are not adhering to the treatment, the tuberculosis can mutate to a more severe form, like the MDR TB, which is multi-drug resistant TB, which again is a prolonged treatment for almost a year, 18 months, and then can further mutate to a severely drug resistant form of TB, which is the XDR. And the fatalities and the deaths with these kind of tuberculosis is very high. So I here would request everybody to get periodic health checkups. The moment you feel you have any of these symptoms like weight loss in your appetite, feeling of well-being, get your routine investigations done, cough, sputum. These are features which are confined to pulmonary tuberculosis. And apart from pulmonary tuberculosis, lymph nodal involvements, where you have lymph nodes in your body which might swell up because of infection. Get yourself evaluated at your close by hospital by a pulmonologist. Get yourself evaluated, screen for tuberculosis. Stick to it. The government has made big inroads in the treatment of tuberculosis. It's a notifiable disease. The treatment of tuberculosis is taken care by the government, where you have periodic follow-ups, periodic checkups. The drugs are free. So get yourself evaluated and let us fight against tuberculosis. Wishing you all a safe and a happy life.